Hello, my name is Dr. Paul Macnamara. I'm an orthopaedic consultant specialising in hip and knee replacement surgery. The hip replacement is basically the end process in which the cartilage has worn out both within the acetabulum, which is the cup, and also within the femoral head. It is usually experiences a severe amount of pain, often pain that limits function. Maybe the patient is unable to walk less than maybe half a kilometre. They may have pain at night, and they are certainly severely restricted in their what we call activities of daily living. Some of them may be quite basic, or we would assume to be like putting their shoes on or being able to get dressed. There's a certain amount of stiffness, especially with osteoarthritis, again, that limits function and just ruins the quality of life. Perhaps patients aren't able to undertake the hobbies they like, for example with golf or just walking, and that they are suddenly having to counter and change their lifestyle accordingly. We can, on the initial stages of arthritis, try and treat this with physiotherapy and with anti-inflammatories, and we would advise a patient to lose weight in the interim. However, the end stage of this severe arthritis may mean that they require a hip replacement. So a hip replacement is essentially a procedure where once the articular surface of the cup and the femoral head have worn completely, that we have to replace that. So we do that with a series of steps, one of which is to put the cup into the acetabulum. We then also, with the hip replacement, have to remove the damaged femoral head, and we have to then insert a femoral stem into the femur itself. When will we use it? Well, certainly we would take a history out of the patient, and we would find out how severe their pain is. The degree of pain is important, and on the whole, if your sleep is being affected by this pain, particularly at night, and you're not able to sleep, that is a good indication that you may require a joint replacement. Certain amount of pain, maybe going into the shops, and may be manageable with anti-inflammatories, may be manageable with weight loss and good physiotherapy. But once we get to the point where we've exhausted this, then a hip replacement will be required. So a hip replacement is basically when there is a replacement for the damaged cartilage. So when you have bone on bone. The typical age for a hip replacement used to be for the elderly patient, but certainly as I've progressed in my career, the patient population has got younger, and they are more demanding, and they want to do a lot more with their hip replacements, and this includes playing golf or going sailing or even running, which we don't necessarily recommend, but patients are doing this. With regard to the age group of the patient, I have actually done a 14-year-old here in Dubai who had a completely smashed hip after a road accident. So there really is no set age, but on the whole, most of the population is in their 60s and 70s still. With enhanced recovery programs, certainly complications are very much minimized. But we always have to counsel patients for certain complications, which include infection, leg length discrepancy, bleeding, nerve and vessel damage, dislocation and fracture, as well as general risk of an operation, which include heart attack and stroke. These are less than 2%. People argue about exactly how much, but it's certainly minimized and mitigated against, and certain things are done within the hospital setting to keep that risk at an absolute minimum. The advantage of the hip replacement is to get the patient out of pain and then to start their lives again and functioning as they would wish to function, and getting back to their hobbies and their sports that they would enjoy, and having a full and active life. It is voted the operation of the 20th century, and it really is quite transformative, and especially if you get the patients early. So the delay in hip replacement can certainly make it more technically challenging, especially with the amount of bone loss and the muscle wasting, and certainly this will affect the rehabilitation later if you've been waiting a long time to have a hip replacement. And certainly the psychological impact as well. Being in that much pain is going to take a long time to recover from. So it is better, if in the right indication, to have these things done early. So rapid recovery is a series of principles to try and minimize the complications and improve function in hip and knee replacements. And these are all the factors in and around the hip replacement itself to minimize the risks and also improve the outcomes. And this includes the pain relief, as well as the transfusion requirements, which we don't virtually give no blood to any joint replacement these days, and the mobilization. And with that, requires a team approach. So the nurses in the clinic and also in the ward, as well as the physios, are most important people in this, and the theatre staff, of course, so that we can replicate and do things in the same way every time. So with that comes a greater interest in trying to get the pain relief right, particularly before, during and after the operation. And you see surgeons nowadays who undertake these types of procedures being very actively involved in trying to get the patient's pain relief correct. And we flood the area in an operation with a lot of local anaesthetic, as well as trying to minimize the amount of opiates so that patients are not falling asleep 2 or 3 days after an operation, so that they can get up and mobilize almost immediately after a procedure like this. And the results are quite dramatic now, to the point where a young, healthy 55-year-old could go out of hospital either the same day or the day after surgery. During our hip replacement, we make a very clean approach down into the hip, and we expose the cup, the acetabulum. We have already seen on the X-ray that there is no cartilage left. And as a result, we have to replace this cartilage with the artificial bearing surface of the hip. You can see that here, this has a special coating on it that allows bone to grow into it. And in this uncemented implant, we press fit the cup into the hip itself. We then put in a bearing surface, and in this case it's a ceramic bearing surface, although these days I tend to use a high-dense polyethylene on this surface. And I slot this into this, like that. We then turn our attention to the femur. Again, the cartilage on the femur is diseased and virtually gone. So we have to remove the neck of the femur and put in the hip as such. And then we insert the head on top. Eventually, this will articulate with this. Is hip replacement a major operation? In the right hands, it's a fairly standard operation. Millions have been undertaken throughout the world, and they're improving results. Patients have fantastic recoveries on the whole from this, and given the right surgeon, should have very good outcomes. The length of stay is variable depending on the patient. A young patient can go the same day within 24 hours and a maximum 48 hours. Even the older patients these days are out of hospital, pain-free and mobilizing within 48 hours and no transfusion. With the enhanced recovery techniques, we try and minimize the pain to the point where patients are immediately walking. And a lot of patients describe the pain being switched off like you would switch off a light. So in actual fact, with the cocktail of medication we use and the rapid enhanced techniques, the pain is minimized to virtually nothing. So the actual procedure from the initial cut and then putting in the implant and then closing the skin, this takes between 1 hour and to 90 minutes. There is a further time both before and after that with the anaesthetic of putting in the local and also putting in the spinal anaesthesia, and also the post-operative recovery. And that's somewhere between 2 to 3 hours on the whole. We then generally start to mobilize the patient within about 4 to 5 hours after the procedure. So in the Emirates here, because my population is usually slightly younger, as I say, about 40 to 50 years old, I use an uncemented implant, this being one of them. This is one of the latest ones on the market, and it's well respected both in the UK, US, and in Australia, and is a well-known implant. This is a ceramic head, this is a ceramic bearing surface. and it has a 𝗙𝗵𝗄𝗃 coat, which is a special coating that allows bone to grow over the top of it, and you can see that in this. So the post-operative course definitely varies between individuals. So patients are mobilising on day one, and there's certain walking around, but there are restrictions we ask of them for the first 6 weeks. And that bending below 90 degrees, so not getting into a low chair or into a low toilet seat, would definitely improve their outcomes. We also tell patients that we have to take the clips out or the stitches 10 to 14 days. So we're also putting patients on certain driving restrictions, usually about 3 to 4 weeks, and usually the same with the swimming pools. I also say that not overdoing it in the first 6 weeks is very important. So not going on any long hikes for about 6 weeks to 3 months, depending on the patient. And that is the key to it. Everyone heals and recovers in a different way. Given the fact that my population is certainly younger and much more active, I have to slow them down to a certain extent. So I tell them not to say do 9 holes of golf until about 6 weeks, and certainly no long hikes. I've had patients who really want to get going after about 3 to 4 weeks, and they forget they've actually had that operation, particularly hip replacement, at that time. But at that point, it's very critical that they follow the rules that I set, and maybe wait a little bit longer until all the soft tissues and healing process has taken its course. You can most certainly live a normal life, and even perhaps a better life than before you had the hip replacement. This gets you out of pain. Fundamentally, this keeps you independent and keeps you doing the things that you want to do. And that may be just being able to go down to the shops or socialise with your friends, but it gets you out of the house, or maybe it requires you to go hiking or doing all sorts of activities, but it makes you have a better and